Hello friends in Anatomy and Physiology class. This is Hassan Lafid, your Anatomy and Physiology instructor at Madison College in Wisconsin. Tonight we're going to talk about the eye. The eye is one of the sensory organs. The eye is found in the skull. It is located in the orbit, and this is a bony part which contains the eyeball. Each eye is about 2.5 centimeter in diameter. It's a spherical shape. The eye is protected by eyelashes, by eyelids. The eye has muscles. The eye has extraocular muscles. These are muscles that direct the movement of the eye to the sides or up and down. These are known as the recti. There is also smooth muscles that controls the amount of light that can get through the pupil inside the eye. Let's go and take a look at the features and the parts of the eye. Looking at the visible part of the eye, we are going to identify the eyelids. Eyelids are known as palpebrae. This is the tarsus. The tarsus of the upper eyelid, and this is the tarsus of the lower eyelid. If I lift it up a little bit for you, lower eyelid tarsus and upper eyelid tarsus. This is the lacrimal gland. The lacrimal gland secretes the tears. The tears contain fluid that protects the eye, moistens the eye, and it does have antibacterial action that protects the eye from infection. Secretions of the lacrimal gland will be smearing the eye. It goes on the side of the eye. This is known the lateral canthus. This is the medial canthus, and this is the lateral canthus. Medial, lateral, because this is the nose, so this is the nasal part. Also, secretions of the lacrimal glands after moistening the eye will go to the canaliculi, to the lacrimal canaliculi that will collect into the lacrimal canal, and then lacrimal canal will drain into the lacrimal sac, and the lacrimal sac will drain the fluids into the nasolacrimal duct. The nasolacrimal duct, of course, is going to open into the nasal cavity. Looking at the outer part of the eye, as you see, the white part is known as the sclera. The color part is the iris. Iris color differs from person to person, from race to race. For example, somebody with blue eyes will have a blue iris, black eyes, black iris, and brown eyes, brown iris. This opening is known as the pupil, and this is the window through which light gets into the eye and causes vision. Pupil actually constricts when there is light and dilates when it's a little dim or dark. Pupil reacts to light, and that's why pupillary reflex is used to check for some of the tests in the eye, specifically for reaction to light. Looking at the extraocular muscles, or the muscle that control the movement of the eyeball, we have the superior rectus and inferior rectus, lateral rectus and medial rectus. This is a tendon of the oblique muscle, and this is a tendon of the inferior. So the superior oblique muscle and inferior oblique muscles. Muscles of the eye are also better studied and understood in this model, as I'm going to show you right here. It does have clear tendons and muscle straps of the extraocular muscles. So if you look at the eye from the front, also again, this is the nasal part, this is the temporal part. The temporal part also is by the side of the lateral side, and the nasal part is on the medial side. So with that being said, this is going to be the lateral rectus muscle, and this is going to be the medial rectus muscle. You won't see it from here, but in the other side. This is, if we take this out and lift this a little bit, tip it over, this is going to show you the tendons of the superior rectus muscles. While here, if we go this way, we're going to see the tendons of the inferior oblique muscle right here. This is the tendon of the superior oblique, and this is the inferior oblique. So inferior oblique, superior rectus, lateral rectus, medial rectus, and inferior rectus. Extraocular eye muscles move the eyeball to different directions. Superior rectus muscle moves the eye upward. Inferior rectus muscle move the eye downwards. It also, the superior oblique muscle elevates the eye and turns it medially. So it elevates the eye and moves the eye medially, while inferior rectus depresses the eye and turns it medially too. So it helps us to look at our feet and to the medial part or the inner part of our body. The lateral rectus muscle here moves the eye laterally, so to the outer part, while the medial rectus muscle moves the eye to the medial part. The inferior oblique muscle in the other side elevates the eye and turns it laterally, so it helps the eye to look up and to the lateral side. The superior oblique on the other side helps the eye to look down and lateral. These are known as the extraocular muscles. These muscles are supplied by the cranial nerves, and all the muscles of the extraocular muscles of the recti are supplied by the oculomotor nerve, which is the third cranial nerve, except the lateral rectus, which is supplied by the abduction, and the superior oblique also, which is supplied by the trochlear or the fourth cranial nerve. Putting this back again, I wanted you also to realize this is the tendon of the levator palpebrae superioris. Levator palpebrae superioris. This is the muscle that elevates the upper eyelid. So you have to take this out to identify the muscles or the tendons or the cut off part of the superior rectus muscle. Putting it back here, this is going to be the tendon of the superior palpebrae elevator or elevator palpebrae superioris muscle. Taking the outer part of the eye model out, we will identify the optic nerves here, and the optic nerve kind of runs backward and intersects with the other optic nerve of the optic chiasma. This is another model of the eye. We will use it to show the layers of the eyeball. The eyeball has three layers. The outer layer that you see out here, this is a fibrous layer. If we take this part out, it's going to show the middle layer, which is the vascular layer or the choroid. Got a lot of blood supply here. You see nerves, veins and arteries, little nerves here. In the back, you will see the optic nerve coming out. And if I took this piece apart to show you the inner part of it, before that, let's just go again over and show you the other part of the exterior part of the eye, which is the 1/6 part of the eye. It's important to know that about 1/6 of the eyeball only is shown outside, while 5/6 of the eyeball is inside the bony part of the skull or the orbit. So this is again our iris, pupil, iris, and this is the white of the sclera shown from outside. So this is the vascular layer, and if we opened it, we are going to find inside other parts. We're going to find the lens and the two chambers. We're going to find the anterior chamber. This is the lens, and this is the area between the lens and the posterior room. It's known as the anterior chamber, and this is the posterior chamber. The anterior chamber has a clear liquid. We call it the aqueous humor, while in the back we're going to find the gelatinous part. We call it vitreous humor. This constitute the back room of the posterior chamber of the eye. if we take this out here, and we take the lens out also, we will find the neural layer. And the neural layer is the retina. And the retina, if you see here, this is where the optic nerve exits, and this is known as the blind spot. Lateral to it, you're going to find the area of the best vision, which is the fovea centralis. You see a lot of loss of blood.